Frequently, people ask me what are the benefits of getting the vaccine. I think it's very important to understand what will be the risk of not getting the vaccine. Here's what we know so far. We're dealing with a new infection that is causing havoc under the community. It's not like anything that we've ever seen. What we know is that approximately 31 million people in our country have been affected by this virus, of people that we've tested. Of the 31 million, 560,000 of them have passed away. It's enough to cause a mortality around 2%. It's also enough to be the third leading cause of death in our country for the past year. It has shut down health systems, it's overwhelmed morgues. So the key to me is, what are the risks of not getting the vaccine? The benefit shows us it prevents severe illness and death at a very high rate. Looking at the data and the research, I can also tell you that this vaccine is very possibly more safe than medications that I prescribe on a daily basis to treat any patient in the hospital. So many people say, you know what, I'm gonna take my chances. I'm not gonna get the vaccine, I'm gonna wait. I'm gonna wait to see the long-term effects of getting the vaccine. And you know what, I think I'm healthy enough, I believe I can handle it. Looking at the total picture, looking at the past year, I would say that that is a very bad bet to me. I don't know if our country can afford being shut down again. I don't know if we can afford keeping children home again. Betting to not get the vaccine is also betting to take your chance of getting the virus and causing destruction not only of your career, not only of your health, but also the potential of it happening again and again and again. So my first patient was March 10th. I would never forget her. And since then, it's come in waves, and each wave is completely different. This most recent wave, the patients that I'm treating today, are ironically patients who had the opportunity to get the vaccine and they did not get it. And when I talk to them and when I talk to their families and I discuss why they did not get the vaccine, they're still very reluctant. The main reason that I hear is fear. They're afraid of getting the vaccine. It's a new medication, a new treatment. They don't know what the long-term effects are gonna be. But being a physician that treats coronavirus, let me tell you a secret. When you're in the hospital with me, I don't know what the long-term effects are gonna be if you're on a ventilator for a month. I don't know what the long-term effects are gonna be if you're on 100% concentrated oxygen for weeks. I don't know what the long-term effects are gonna be if you're on steroids for greater than 10 days. But what we do know are the short-term effects and what are becoming the long-term effects of this virus. We know that if you're in a hospital with me, 50% of the patients are gonna have neurological disease, whether it's just a headache up into having seizures and strokes. We also know a significant portion are gonna have cardiac disease. We also know some people are gonna end up having this long haul or this long COVID type of syndrome in which they just don't feel well and just don't feel themselves, like my friend is currently in the hospital. With this being said, our reluctance to get the vaccine is mostly based on fear, but as a country and as a medical community, we've been using and studying vaccines for over 200 years. They are by far the safest of the medications or medical therapies that we can give to people. I was reluctant, I was skeptic to get the vaccine, I was scared. Since March 10th, every time I've gone to work, I had to treat a coronavirus patient. And what finally convinced me to get the vaccine were the studies. The studies, in a sense, shown that they were safe. And the people that I trust the vaccine. The people who have been training me in medicine for 15, 16 years reviewed the vaccine. They studied the vaccine. The specialists who make vaccines approve the vaccines. But lastly, when I came home, and I believe it was December 13th, when I walked through the door, my children ran up to me and said, "Daddy, did you hear? The vaccines are ready. You can finally get the vaccine and be safe." So at that time, I realized, oh my goodness, my children and my wife, they're terrified about me going to work and possibly catching this virus and bringing it home. I tolerated the vaccines well. My mother and father gotten the vaccines. My two sisters gotten the vaccine. My wife just gotten her first dose, and she's actually a nursing mother. So while she's nursing our 9-month-old son, She's gotten the vaccine. First, to everyone that's watching, it's been a very hard year. And I just want to say thank you. If you wore your mask, if you got the vaccine, thank you. If you did not get the vaccine, if you're still concerned about it, I just want to let you know that I'm available to you. I'm one of the people who are treating these patients. If you would like to contact me or contact your primary care providers or just people in the community, please talk to them to discuss getting this vaccine or not. Again, I don't sell the vaccine. I don't work for these companies, but I'm obligated to give you the medical truth. I'm obligated to tell you what's best for your care at this moment. And right now, it will be the mask and the vaccine.